Hello, everyone, and welcome to Expert Nutrition and Exercise Advice for Sarcoma Patients. During this webinar, all participants will be in listen-only mode. Please remember the information provided in this webinar is not intended as a substitute for your physician's guidance and care. My name is Rebecca Pauley. I'm the Program Director of the Life Raft Group, and I'm happy to host this webinar today. I would like to first introduce our panelists. Dr. Harleen Kaur is a behavioral scientist with a PhD in nutrition sciences from the University of Alabama at Birmingham, where she was supported by the T32 Cancer Prevention and Control Training Program at O'Neill Comprehensive Cancer Center. She is currently supported by the T32 training to reduce burden across the cancer control continuum multidisciplinary program at Sylvester Comprehensive Cancer Center, where she is advancing her training in lifestyle medicine and oncology research. Her research focuses on the design, implementation, and evaluation of multi-behavior diet and physical activity interventions during active cancer treatment and survivorship. Her work aims to advance precision lifestyle medicine through scalable, digitally supported behavioral strategies, leveraging digital technologies to expand reach and incorporating artificial intelligence to enhance personalization. Dr. Loren Yavelberg is an exercise physiologist with a PhD in applied cardiopulmonary physiology, whose research focuses on exercise oncology, lifestyle medicine, and supportive care interventions across the cancer continuum. His work integrates clinical trials, community-based programming, and behavioral strategies to improve treatment tolerance and patient outcomes. Thank you both for joining. So we are going to turn first to Dr. Harleen Kaur, if that's okay.
Yes, that's perfect. Thank you so much for the kind introduction. Dr. Yavelberg, do you mind sharing your screen? Perfect. All right. Well, thank you everyone for being here. And it is a pleasure to be here with you guys and talk a little bit about lifestyle medicine in the sarcoma care. So next slide, I want to start off by giving a little bit background on sarcoma cancer survivors. So sarcoma really is a rare cancer type diagnosis where approximately 1% of adult cancer survivors are actually diagnosed with sarcoma. But this cancer type is quite diverse, where there are about 70 subtypes for this cancer type specifically. Now, the most common type of sarcoma is soft tissue sarcoma, where approximately 14,000 new cancer diagnoses have been diagnosed annually in the US. And gastrointestinal stroma tumor is part of this category. Now, the good news is that the amount of therapies and cancer treatments that are out there are working, and the 5-year survival rate for soft tissue sarcoma is approximately 65%. And research has been showing that in the next 20 years, the survival rate is about to increase to 70%, which means that the number of sarcoma cancer survivors are increasing, and this is quite encouraging. While this is great, there are some concerns that we should think about. One is that the survivorship needs for sarcoma cancer survivors are an important topic, and that is because cancer treatment, specifically surgeries and chemotherapies and immunotherapies, do lead to cancer-related side effects that we call in research, such as fatigue and GI symptoms and weight changes and muscle loss. And these are factors that can impact the overall quality of life of cancer survivors. And hence, lifestyle medicine can really play an important role in reducing the burden of these health conditions. So our next slide, I want to talk a little bit about lifestyle, why lifestyle really matters. Now, over the course of our training, we have worked with behavioral scientists and registered dietitians and exercise physiologists who have taken nutrition, basically what we eat and exercise, how much we move throughout the day, and how these factors play a role in improving our outcomes, such as fatigue, our physical function, our quality of life, and also how all of these two factors can potentially minimize cancer risk and cancer recurrence. But in the next slide, I want you to think about lifestyle as a multifactorial or a multi-designed approach where nutrition and physical activity are the main components, but there are also other factors that are equally important. So in our lab, we really think about lifestyle as a wheel, and that wheel really has the opportunity to highlight nutrition, physical activity, sleep, stress management, and other risky substances that can all play an important role in our cancer risk, and how we can make healthier and sustainable behavior change habits on a daily basis to live a more healthier lifestyle. So in the next slide, my role is to talk a little bit about nutrition. So nutrition is always a hot topic. Everyone wants to know what should they eat, how much should they eat, how much should they weigh, what are some supplements that really help, during cancer treatment. So there's a lot of topics that individuals want to know about nutrition. But the basic understanding I want to focus on here is, well, nutrition has two components. One is our macronutrients, and the other is our micronutrients. Nutrition is an important factor in our life. It really is the basis of who we are, even culturally, the type of foods we eat. There's a saying that we are what we eat. So nutrition plays an important role in how we live our life. So in terms of nutrition, think about your macronutrients, which is our carbohydrates, our proteins, and our fats. And when it comes to our micronutrients, this is our building blocks of metabolism, which is minerals and vitamins. And nutrition plays an important role where there's research that has been done that showcases that specific diets, such as Mediterranean diet and intermittent fasting, can really have some positive effects. Now, in the next slide, I don't want to go too much detailed into the physiological pathways that have been able to showcase how they can actually reduce cancer risk, but over the course of years, research scientists have come together and they've been able to take plethora of research that have already been done on phytochemicals, polyphenols, antioxidants, in order to provide us with recommendations in exactly what we should eat, specifically for cancer prevention and control for cancer survivors. And these guidelines comes from the American Cancer Society and the World Cancer Research Fund and American Institute of Cancer Research. And these guidelines maintain that one should follow a healthy eating pattern, which includes a lot of fruits, so a total of 5 servings of vegetables, tons of plant-based proteins like legumes, beans, and peas. So aim for about 2 to 3 times per week that you incorporate these options in your diet. Fruits, so about 2 to 3 servings of fruits, as well as whole grains and lean proteins. The recommendations also entail that one should limit or avoid red and processed meats, consume low amounts of sugary, sweetened beverages, and highly processed fruits and refined grains. And when it comes to alcohol, the guidelines are it's best that one should not engage in drinking alcohol, but if you do drink, limit that to 1 to 2 drinks per day. Now, these are great guidelines. In theory, they look great, right? But everyone has their own individual needs, and we can talk about that as we kind of move forward through the presentation. But these are the general guidelines that one should really think about when they're thinking about how they should, what kind of diet they should follow. Now, in the next slide, I always try, when I do some of these community events, I always try to give 3 foundational nutritional principles in order to have a healthier plate, right? So one is always build your balanced meal. So start with, what does balance look for you? A good rule of thumb is 50% of your plate can be vegetables, and the next 25% can be divided into grains and proteins, right? So prioritize a simple structure that has high amounts of proteins, fiber-rich carbohydrates, complex carbohydrates, healthy fats, and fruits and vegetables that are colorful. Second factor that one should really focus on is being intentional with your timing, right? So we all live a very busy life. Everyone has different things that they're trying to do throughout their life. So how do you really be intentional with your timing? So It's always good to think about what are your peak times and how does your circadian rhythm align with your body. So thinking about fueling early and not relying overly on caffeine and being really intentional with your diet is extremely important. I think, Lauren, the presentation has disappeared.
Okay.
I
Sorry, I have it here. Let me try to share screen again. Mm, Is it back up for you?
Yes, thank
Oh,
you.
sorry about that.
Perfect. Sorry about that. And the third factor really is being consistent and realistic. There is no best diet for one person. It's really important to understand what is a healthy eating pattern that works for you, for your health condition, and go from there. So the best plan really is the plan that works for you in your real life. All right, next slide. So a quick example for a busy workday, when things may not go your way, and you're trying to think about how do you plan eating better and not going out and eating. I always kind of think about our day as morning, midday, and afternoon, right? So if you can plan around your schedule, you'll be able to be more mindful of what you're really eating. So in the mornings, always try to prioritize that you eat something because when individuals do tend to skip the morning meals, you're more likely to overconsume later in the day. So try to plan a morning breakfast. If you're fasting, whatever your first meal of the day is, try to have that during that consistent time. That way, your body is used to maintaining that fasting rhythm that it does maintain, but also fueling in the morning when you need to. Middays, that's when things get really busy. That is where you try to keep things quite simple. So during the midday, a sandwich, a salad, a quick protein bar, a quick protein shake. These are good things to have in handy. Nuts in order for you to have something when things are getting a little bit busy. And then you have your later afternoon and evenings where you really want to snack on something. This is when you go for your hummus, your proteins, your fruits and vegetables in like little cheese boxes that you can depend on and keep that consistent. Try to have that meal plan throughout the week. This way you're able to be prepared and you won't reach for things that, aren't as healthy. So with that, I'm going to move on and I will let Dr. Yavelberg talk a little bit more about exercise. And I know everyone has a lot of questions on other items related to diet. So we'll discuss that after the presentation's over.
Great, thank you for that. So we're going to change gears over to the other piece of the lifestyle medicine wheel, which is um, physical activity. Physical activity and nutrition often go hand in hand. And so physical activity is one of the pillars of lifestyle medicine. It can prevent, treat, and even reverse chronic diseases such as cardiovascular disease, side effects of stroke, type 2 diabetes, and even some cancers. And evidence suggests that aerobic and resistance exercise is most beneficial. And so we know a lot about exercise, but there are also some misconceptions that exist within the general public and the literature as well, right? So, patient sees his doctor, and patient says, fitness experts say your muscles need plenty of rest between workouts. Well, while that is partially true, the doctor says, well, your last workout was 17 years ago, right? So, a little bit of a misunderstanding of how much rest is really required between workouts. We know that exercise and going to the gym is good, but yet in some places in the world, we have an escalator leading up to the gym. Somebody says, I do 2 hours of cardio every day, but I still need to find the closest parking spot to the gym. And, the idea here is that really every step counts towards your physical activity and exercise goals, and every step carries a benefit. Some people say I do 5 sit-ups every morning. It may not sound like much, but there's only so many times you can hit the snooze button, right? So somebody, what really is a sit-up and what counts as a sit-up. But nonetheless, what people count as exercise. It varies. But the time is now. We have an INICTO consortium, which is exercise and nutrition interventions to improve cancer treatment related outcomes. So we have a group of R01 institutes, so a very high caliber institutes like the University of Miami, Yale, Harvard, so on and so forth, who are coming together to collaborate on research funded by the National Cancer Institute to have collect similar outcomes and be able to make conclusions across varying studies and populations. We have studies coming out that are looking at the core competencies that are required, so the skill set that exercise oncology professionals need on an international level, both the United States and in Australia. We have the BBC visiting our cancer center as well as some other cancer centers around the world doing a documentary on rewriting cancer, what it is to be a cancer survivor, a cancer patient, and the services that are available to them. We have exercise hitting the mainstream news, NBC News here, showing that, highlighting a study that exercise may benefit colon cancer patients as much as some drugs, stating that sticking to an exercise program after colon cancer treatment was linked to 28% lower risk of the cancer returning. We have the American College of Lifestyle Medicine now integrating lifestyle behavior assessment tools directly into electronic health records such as Epic. There are studies coming out published in high impact journals like the Journal of Clinical Oncology, accepted by the American Society of Clinical Oncology, now highlighting exercise, diet, and weight management during cancer treatment. We see JAMA Oncology, another very high impact journal, highlighting how the adherence to the American Society Nutrition and Physical Activity Guidelines. And so here what they're saying is they surveyed 10,000 cancer survivors, and while most of them knew the cancer ACS, American Cancer Society guidelines and recommendations, unfortunately only 4% of survivors actually adhered to all four guidelines. And so there's knowing and then there's doing, but the good thing is that the time is now, and there's um, this is an ever-growing body of literature with very strong evidence. We see exercise as medicine being accepted into oncology and ways that we can engage clinicians to help patients move through cancer. We see an agenda to make exercise standard in oncology practice. We see BBC News picking up another exercise and colon cancer survival study. And so, in addition to all of these news outlets, peer-reviewed publications, and high-impact journals, we also see Netflix picking up the concept of longevity and exercise and movement, as well as nutrition, in this documentary called Live to 100: The Secrets to the Blue Zone. Now, I'm not going to speak too much about this because I don't want to ruin it for anybody. It's a lovely documentary, and it's really well written and well done. But what we see here is that they, much like the lifestyle wheel of lifestyle medicine that we proposed earlier, we see how the documentary is looking at these different zones around the world. One is in Loma Linda in the United States, another one is in Sardinia, Italy, and another one is in the Okinawa region in Japan. These three areas have the highest number of people living over 100. Now, they looked at their lifestyle and what they do and how and why these people may be living so long. They found that they eat wisely, they have a connected mentality, they move naturally, and they have a positive outlook with a general purpose. So they integrate the older population into society. They're not overly industrialized, so they do a lot of things by hand. They garden, they walk. For example, in Italy and Japan, this is a quite mountainous region. So when they walk even to their next door neighbor, anybody who's traveled to Italy or Japan knows that some of these inclines that they walk are quite steep. And so even though it's a walk of just a few steps, that incline is quite significant and carries many health benefits. They eat a plant-based diet, they drink some wine in moderation, they have a family first mentality, and they feel connected to the right tribe. When they look specifically at what these people are doing in Loma Linda, they have a healthy social circle, they eat nuts, which we recommend as part of the Mediterranean diet pattern. In Japan, they have a no time urgency, which we sort of have down here in Miami to a certain extent. They eat a lot of turmeric in their diet. And in Sardinia, Italy, they have a high proportion of fava beans and high polyphenol wines. Some of what these three regions have in common is this family mentality. They don't smoke. They have a plant-heavy diet. They're constantly engaging in moderate physical activity. They have social engagement, and they all consume legumes. And then we see some other some other similarities like empowering women, getting sunshine, natural sources of vitamin D, and getting outside, and gardening. And then we see some similarities between other regions like Japan and the US. But all in all, very much similar to what our lab does. And so here we see this knowledge translation from the bench side over to the real world, from the science, from the publications to really happening. Some days we hear about something is good for you, and then we hear about how it's bad for you. But in this situation, we see how lifestyle medicine plays a role in these regions throughout the world, and these people are really living over to 100, and they have the largest number of people living over 100. In addition, we see here the ASCO guidelines. So looking at 52 systematic reviews. A systematic review essentially is a review that looks at the state of the literature and brings things together based off of one common research question. And so what this review found is that the evidence base consists of 52 reviews, all consisting of additional studies, essentially. And so they found that exercise during cancer treatment led to improvements in cardiorespiratory fitness, strength, fatigue, and other patient-reported outcomes. Patients with lung cancer actually found a reduced preoperative length stay and complications. When we look at this consensus statement done from an international multidisciplinary roundtable, they found that overall, they're able to come to the conclusion that exercise training and testing was generally safe for cancer survivors, and that every survivor should avoid inactivity. So where we once thought that exercise or cancer patients should be bedridden and rest and get ready for this fight, there's now this shift happening where we're actually advocating for exercise and physical activity and movement and trying to avoid inactivity as much as possible. In another paper published in the Journal of National Cancer Institute, exercise oncology comes of the age. There's more than 30,000 peer-reviewed citations in the literature and multiple guidelines published by major medical institutions suggesting that there is strong evidence from randomized control trials of the role of exercise in oncology care. And this leads us to these type of beautiful tables here, which show us specific dose-response relationships. So we have specific prescriptions of aerobic resistance or combined exercise and their effect on health-related outcomes in those with cancer. So we see that there's strong evidence for exercise and cancer-related fatigue and their respective doses. We see the same hold true for health-related quality of life, physical function, anxiety, depression, and some moderate evidence in bone health and sleep. But the point is that the strong evidence exists, and these health-related outcomes are strongly related to chemotherapy and treatment progression. So if somebody is experiencing extreme fatigue or loss of physical function or high levels of anxiety, depression, or lower quality of life, a medical oncologist may alter the intended dose. And so this prevents patients from getting their full intended treatment plan. And with incorporating exercise into cancer care, we're able to also improve treatment tolerance and ensure that patients get their intended dose. The other important piece of exercise in health is this graph here, where what we see is age along the x-axis going along the right side, and we see musculoskeletal fitness on the y-axis going up and down. And what we see is, when we're in our low 10s up to our 20s, mid 20s, and really early 30s, we're sort of in our prime, right? Which I'm sure many of us on this call can relate with. And over time, unfortunately, we begin to age and our musculoskeletal fitness goes down if we don't exercise, right? And what happens is, as we age, this line comes closer and closer and closer to the line of disability or the threshold of dependence. And so by exercising, we're able to maintain our musculoskeletal fitness and prevent this decline and ultimately preserve our independence. So it is important to note that there is an appropriate amount of exercise. No exercise really carries the highest risk here. This is where we are with the current guidelines that suggest about 150 minutes a week of moderate to vigorous physical activity. There is some benefit at the high intensity training volume, but then there is also a point in this curve that's known as the extreme exercise hypothesis. Essentially, if exercise was infinitely good for us, we would never find athletes having cancer and other comorbidities, right? And so there is an optimal level here of participation that exists, and the idea here is to show that there is benefit in the current guidelines and also more benefit with a little bit more exercise. This has really set the stage beautifully for one of the studies that we have, which is an active SARC study. Cancer is the leading cause of disease-related death in children, teenagers, and young adults. Each year, more than 300,000 children and adolescents worldwide are diagnosed with cancer. In the United States, over 16,500 new cases come out annually, which are attributed to 5,000 deaths. This study is a study for children's, teenagers, and young adults who are newly diagnosed with sarcoma and are going through intensive therapies like chemotherapy, surgery, and other systemic therapies that result in toxicities, functional decline, long-term physical and emotional challenges, and poor physical resilience. Adverse effects we know negatively impact quality of life and often, as I mentioned, result in dose reductions and treatment delays, potentially limiting the efficacy of cancer therapies. And we also know that survivors have an increased risk of many other chronic health conditions, including heart disease and diabetes, due to inactivity both during and after treatment. Currently, fewer than half of the childhood cancer survivors actually meet the physical activity guidelines, which indicates the need for tailored interventions to improve their quality of life. And physical activity, as we've spoken, and exercise has emerged as a safe and promising adjunctive therapy in oncology. Yet there's a lack of prospective data for structured exercise interventions in this young population specifically. And so in the ACTISARC study, participants are randomized into usual care or exercise intervention. If they randomize to an exercise intervention, we'll send them a set of resistance bands to use in their home, as well as a Fitbit so we can monitor their physical activity levels and their sleep. They'll also work with one of our exercise oncology specialists 3 times a week for a supervised exercise intervention for a total of 12 weeks. The exercise intervention includes a warm-up where they have some dynamic movements to prepare the body. They have some about 15 minutes of aerobic training where they walk at a moderate intensity to improve cardiovascular endurance. Then we transition over to a resistance band protocol where we alternate upper body and lower body activity, and we use this to build muscle and strength. Following this, the resistance training protocol, they'll move over to the balance training section to improve their balance coordination and stability because about 50% of the patients who will initiate chemotherapy may result in some level of surgery, which could be limb-sparing surgery or or resection. And finally, we'll conclude with cool down, which consists of stretching and breathing exercises for recovery. And so this is sort of some of the research that our lab does, and one of the studies that are most applicable to the population or the group that we're speaking to today. But I wanted to show you some of what the evidence base suggests, where the literature is at, and some of the work that we're doing to hopefully motivate you and also educate you on what is available and what you should or can be doing. We'll now change gears over to another piece of the lifestyle medicine wheel, which is sleep. Right? So nutrition is very important, physical activity is important, but we don't reap the benefits or the full benefits of lifestyle medicine and really prevent disease without practicing a little bit one of each of these pillars. And so with sleep, we want to ensure both adequate quantity and quality of sleep. When I speak about this, I always say, you don't want to lose sleep over not getting good sleep, right? So don't let this keep you up at night. But what we can do is try to practice better stress management techniques, for example, or maybe put our phone away in the hours leading up to bed. We know that most ovarian cancer survivors experience poor sleep quality, duration, and efficiency, and this can actually be linked to reoccurrence risk. There was a very large Nurse Health study that was done that looked at nurses who worked at overnight shifts and who had fragmented sleep were at increased risk for developing a cancer. Sleep disturbances are also among the most frequently reported disease and treatment-related side effects in cancer patients, as I'm sure many of you on this call today likely experience. And sleep disorders significantly affect quality of life and have been shown to have a negative association with cancer reoccurrence. So it's really important to try to get the best possible sleep that we can, but not focus only on the quality, but also on the quantity of sleep, right? And there are various ways and techniques that we can have better sleep quantity and quality in our lives. The other piece of the wheel here, the other pillar, is stress management techniques. So practices such as mindfulness, meditation, or yoga, doing some deep breathing exercises. Now, this doesn't have to be an hour. This can be 5 minutes. This can also be a few different breathing techniques throughout the day. For example, the inhale, hold for 4 seconds, and then exhale. So they call this like the 4-2-6 breathing. A mindfulness-based stress reduction therapy can significantly improve patients' coping abilities, reduce adverse emotions, improve emotional states, and quality of life. And so it's important to try to make a best effort to really think about what it means to be healthy and how to incorporate lifestyle medicine in your day-to-day lives, and to try to place equal emphasis or equally acknowledge these different pillars. And with that, I'm going to pass it over back to Dr. Kaur.
Yeah, and as we wrap up our presentation, the last pillar that we want to talk about is risky substances. And a lot of times, individuals think of this as, of course, smoking and tobacco intake, which has shown causal association when it comes to cancer risk and cancer diagnosis. But there was a report that came out on alcohol intake by the Surgeon General 2 years ago that has also categorized alcohol as a risky substance. And it really suggests that alcohol can increase the risk of developing at least 7 types of cancers. And this report has the ability to also showcase that when individuals do consume alcohol, when it's metabolized or it's broken down, it does have the ability to damage our DNA, which causes cell damage and further enhances inflammation within our body and can increase our cancer risk. So to this population, I would suggest that if you are consuming alcohol, I would consume at least more. I would think about how alcohol can impact your cancer diagnosis, and think about really moderate to low drinking, if possible, which is about less than 1 drink per day, or less than for women, and then less than 2 drinks per day for men. And lastly, I also want to mention that there are some alternatives when it comes to alcohol consumption. There are different types of sparkling waters that can be created. You can depend on more herbal teas and kombucha, which is really good for gut health, infused waters, as well as non-alcoholic beer that can serve as good alternatives as you're going through making this transition for yourself. And lastly, as we wrap up this presentation to answer some questions for you guys, really think about, Loren, can you go to the next slide? Really think about how can you live a healthy lifestyle for yourself, right? So think about, how do you eat and exercise with intention, and how can you incorporate that within your daily life? It's important to think about taking preventative measures and thinking about lifestyle medicine within your lifestyle, and learn to build a base that incorporates that lifestyle wheel that we talked about, which is nutrition, exercise, sleep, and managing your stress and other behaviors in order to live a more healthier lifestyle. So thank you so much for your time, and we're happy to lead the discussion on any questions that you guys may have.
Thank you to the organizers and everybody who's attended here. We had a blast talking to you all, and I know that there were a lot of questions, so we tried to keep the presentation short and sweet so we can best answer some of the questions that you may all have. So thank you all.
Thank you both. I appreciate this because there were many questions coming in, especially in registration. I want to get to those first, and then we'll address the Q&A. So let's jump right into it. Are there foods that reduce GI inflammation and irritation?
Yes. When it comes to GI discomfort, this is something that's quite common for a lot of cancer survivors because cancer treatments can cause a lot of GI discomfort, nausea, as well as diarrhea. So, some of the good recommendations really is to have smaller meals, but have more frequent meals. Try to stay away from those spicy foods that can really cause that GI discomfort. And there's also some evidence in also avoiding some grapefruit and grapefruit juices. Another suggestion that I would offer to a lot of our participants today is try to have a journal. When you have a journal, it can really help you understand what you're eating, when you're eating, and how you're feeling. So, if you're someone that really experiences a lot of GI discomfort, try to have a 1 month journal where you have the frequency of food you take and when you eat it and how you feel after those foods, because that can really help you be mindful in understanding, okay, these are some foods that are really, impacting me on a daily basis, and how can I have a different substitute? And this can also help if you have a registered dietitian or a nutritionist or even your healthcare team understand what is really going on.
Awesome. I love that advice. Are there any foods or supplements that suppress cancer growth?
A perfect answer to that, right? So I will not say that there's one specific food that has the ability to suppress cancer growth, but if you remember the slide that I showed on the guidelines, these guidelines really do come from a lot of different cohort-based longitudinal studies that have shown that a nutrient-rich dietary pattern, specifically a Mediterranean diet that incorporates a lot of fruits and vegetables that are spinach, right? Arugula, those crucifers greens really have those high antioxidants and polyphenols that have the ability to fight inflammation within your body and then can potentially reduce your risk. So a lot of those healthy fats and lean proteins and whole grains, it's more of a pattern than one food that is going to support cancer risk. And then of course we have environmental and genetic factors that play a role as well.
Mhm. Thank you.
Here's a nice slide that we show sometimes in some other talks that we give. I could put it up right now. But Dr. Kaur spoke very well and really hit the nail on the head there with we want a variety and a lot of what we do and recommend and what's in the American Cancer Society guidelines is evidence-based, right? It really comes from a lot of research trials. So one thing that you may have heard Dr. Kaur mention is these phytochemicals, these carotenoids, flavonoids, and phenolic acids, which have been shown and are recommended. So eating a diet that is mimics the Mediterranean diet pattern where we lower red meat consumption, processed meats, low sugar, eating fatty fish and other, like avocado, good fatty oils, but also incorporating strongly pigmented fruits and vegetables like these berries here, red oranges or deep green vegetables as you can tolerate. So of course, if you don't tolerate well, then some of these recommendations may not be entirely applicable, in which case it would be best to, as Dr. Kaur recommended, keep a food journal, food and symptoms journal, or work with a nutritionist who is um, at within the cancer center. I know here at Sylvester we have support services who's able to help with this. and you can see a nutritionist to assist with some of these symptoms and make the best recommendations.
Thank you. We have another question. How can we safely rebuild lost muscle?
That's a great question. So there we have the guidelines that are suggested to be safe and effective for cancer survivors. They recommend about um, 2 to 3 times a week of resistance training activity. You want to do about 10 to 15 repetitions and about 2 to 3 sets.
Mhm.
If you're a little bit of soreness the next day is okay, but if it's debilitating soreness, then the intensity is too much for you, so the weight is too much. A good way to start is maybe using water bottles or soup cans. A liter of water is equivalent to about a kilogram. So you don't have to go out and spend a lot of money on weight. You don't need to use heavy weights. And oftentimes body weight is a good place to get started. So people think about, you go to the gym, you may see somebody squatting a lot of weight, but if you're a beginner and you haven't exercised in a while, simply getting out of a chair or getting out of the couch is very similar to a squat, and you're actually lifting your whole body weight there, which is something that we don't always consider. And it's a great way to engage our posterior chain, our lower extremities, our quads, our hamstrings, our glutes, but also our core.
Thank
Um,
you.
so that's a good place to start. And you generally want about 24 hours, up to 48 between exercise sessions of the same muscle group. So you don't want to be doing legs every day or core every day. You want to switch it up. And there's a lot of great resources online for exercise classes for older populations or exercise classes for cancer survivors. And here at Sylvester, we also offer exercise oncology services where you can see an exercise physiologist and have a plan. And we also have group fitness classes. And there are also, group fitness classes that are available at the YMCA or at a Silver Sneakers program for anybody who's a little bit older.
Thank you. You touched on this a tiny bit, but maybe you could talk more. What are there any exercises that patients should not do as either just patients, sarcoma in general? Maybe talk a little bit more about that.
Yeah, that's a great question. I think that anytime you're looking about considering taking up a new lifestyle, whether it's diet or nutrition, it's always a good idea to speak with your primary care physician or your doctor. If you're ever unsure, you have any questions, or you think it may not be safe for you, it's always best to speak with your doctor or your oncologist first. Generally, if you have any bone metastases, so cancer that has spread to the bones, you want to be mindful and try to avoid any type of high impact activity. So in our exercise programs and some of the studies for metastatic breast cancer patients, I recognize not totally applicable, but still bone metastatic disease. In those programs, our participants complete aerobic exercise on a bike, so not a treadmill. There's no jumping. It's sort of slow and controlled motion. If you've had recent surgery, you want to generally avoid that area until you've received clearance from your medical oncologist or your surgeon. Be mindful of any potential lymphedema, but also keep in mind that exercise and some resistance activity can actually improve lymphedema risks and side effects. So all in all, I think that if you've recently completed treatment or surgery, or have had a recent diagnosis, it would be best to speak to your medical oncology provider or your doctor or primary care physician. Otherwise, if you're a few months to a few years out, you can probably start by slowly taking on some new exercises and unrestricted movement. If you start to notice any pain in your chest, difficulty breathing, or lightheadedness, you should definitely stop right away.
Thank you. We've had several questions come in on this topic, so I want to make sure it gets addressed well. Um, they're very concerned about malabsorption. I have a lot of patients that said they lost a lot of weight. They can't gain weight back. They feel like the nutrients aren't absorbing. Is there a way to test for this? Is there a way to address this? Open to both of you.
Yeah, I think this is definitely it's a great question. It nutrition and vitamin absorption is very individualized. There are tests out there, like blood tests that can be done, for example. There are carotenoid scans that can be done on your finger to look for nutrition. Generally, if and when you have malnutrition, there are generally some signs and symptoms of this within the skin, within the body, within our energy levels, and so on and so forth. If you want to, of course, avoid that, then a blood test is generally a good place to start. When it comes to weight loss, oftentimes this has to do with not consuming enough calories. So we need to begin to think of ways of improving and increasing the calorie intake, but also quality caloric intake, right? Coming from sources that are well tolerated and well digested, but also not just carb or not just fat.
I think
I
I just want to
completely
add in,
agree.
sorry, I just
And
want to add in the fact that a lot of these patients have had surgery on their stomach. So I want to make sure that gets addressed as well. I'm sorry to cut you off.
no, and that's a very valid concern, right? Because with surgery, you're losing a lot of the mechanisms that are involved in observing food, right? And not just digesting food, but observing the nutrients that you need to observe so you can have the proper energy to sustain your body, right? So when surgeries do take place, food does tend to go at a much higher rate to the digestive system and hence causes loose stool. I think that was one of the questions that one person asked. So I think the importance here is really, really prioritizing working with your clinical team and your registered dietitian. This is where your registered dietitian will be able to really understand on different levels exactly what is taking place individually, right? So the registered dietitian who is very much involved in oncology care, but is also working with sarcoma patients and has the ability to understand how panels are changing throughout their cancer treatment and exactly what their needs are. Dr. Yavelberg mentioned calories is extremely important, and so is protein, but exactly what type of protein are you able to, consume? Because with cancer treatments, sometimes individuals are not able to take in meats, right? So the texture and the smell of the meat is something that is not adhered properly by them. And then we have our vegetarians. This would be the opportunity if you are seeing a lot of malabsorption, you're seeing a lot of weight loss that is more than 5%. This is where I would really suggest working with your dietitian.
Thank you. Um, there was also a question kind of related. A lot of people have lost a significant amount of weight and they also have a hard time eating. It's hard to keep food down. They're not like they don't want to eat certain foods anymore. Is there a way to can you address this, how to gain weight when you have all of these challenges?
Yeah, I think this is where parental nutrition can also play an important role. It depends on the severity of how much can you really take in versus not. So, if you're someone who is just not unable to eat, this is where supplements can help, right? And parental nutrition, these are supplements that are created by registered dietitians and are given at the clinical level and inpatient or outpatient. And this type of support is available. So I would definitely consider that. And second is I know I keep going back to the nutrition journal, but those journals can be very supportive in really understanding what are some foods that you're not able to consume versus what are some foods that you're able to take in. And fluids can help here, supplements, protein shakes, of course. Definitely ask your care team to exactly understand if that's a safe supplement for you. But sometimes drinking over eating can be very helpful and supportive.
Thank you very much. And if someone is looking for a nutrition expert or an exercise expert to help guide them, what are some qualifications that you would look for in that person?
Yeah, it's a great question. I think that we live right now in a time of a wealth of knowledge. There's a lot of information that's easily accessible to us. And unfortunately, not all of it is of the highest quality. So this is a great question. I think we generally, if you're looking to speak with somebody, if it's a nutritionist, you want to be looking for an RD, so a registered dietitian. You're looking for advice within the nutrition field, RD is the way to go. If you're looking for advice on exercise, there is a designation within the American College of Sports Medicine called Cancer Exercise Specialist. But then there are other relevant exercise certifications. If you're a survivor or not within treatment, for example, like older age adult cancer classes or sorry, fitness classes or geriatric fitness classes, for example. Looking at sort of age specific is generally a good place to start. If you're younger, then looking for like a younger group fitness class. Um, depending on the individual's complexity and health status, sometimes a personal trainer is sufficient. But if somebody has, going through treatment, has a number of comorbidities or health issues going on, then you want to look for somebody with greater credentialing, like a certified exercise physiologist or a cancer exercise specialist. It's important to note that many cancer centers, not all, but many cancer centers do offer support services to a certain level, and these are all qualified individuals who are screened by the cancer center essentially. If you not able to get to a cancer center near you, your cancer center doesn't offer these services, or you're unable to afford these services. I will just say that in Sylvester, these services are complimentary to the patients. But if you don't fit into one of those, whether you can't afford it or you can't get there or your center doesn't offer it, there is a number of ways to self-educate yourself. And the best way to start would be looking at, for example, in Google Scholar. This is a generally free database where you can look up research articles. And we want to look for articles that are generally done in good scientific practices. Generally, within the US is a good place to start, and published in what we refer to as high impact journals. So these are reputable journals that go through rigorous peer review testing. For example, the journal of like a medical journal, right? Or journal of applied physiology or nutrition journal or JAMA or so on and so forth. The Lancet is another big one, right? And systematic reviews or meta-analysis is a really good way where you can get a picture or a snapshot of the literature. So a systematic review, as I spoke about in my presentation, really brings all the literature together, right? So sometimes we'll hear in the news, one study said coffee is good for you. And then the next day or next week, we hear one study said coffee is bad for you. Or the same thing with eggs, right? Eggs are high in cholesterol, they're bad for you. And then we hear that eggs are good for you. And so this is often the case in research, but research is about the power of numbers. So there may be 1,000 articles or research studies that exist out there, and yes, some will say that eggs are bad, but the majority will say eggs are good, and some will say eggs make no difference. And so what we look at is the power of numbers. So how many say that is good versus bad versus no effect? And this is what a systematic review or meta-analysis helps us understand. So without having to exhaust the literature and look at every single study out there, we can look for systematic reviews or meta-analyses that really help bring all this evidence together.
Thank you. I have a few questions coming in about intermittent fasting. They're a little confused what's the right time frame. I know you answered one question, but maybe talk about it more. Someone
Sure.
else said intermittent fasting versus small meals. Should we do one or the other, both? So maybe talk about that a little more.
Right. So I'm seeing a lot of great questions, and if there's a chance that I can't answer all of them, I do want to direct everybody to the American Cancer Society website. It's cancer.org. where there's a lot of information that is presented in a very digestible manner for the general population, for nutrition guidelines, physical activity guidelines, and so on and so forth. So if we don't get a chance to answer all your questions, the American Cancer Society, cancer.org is a great place to go. And of course, we'll be available if there's anything that we can further help. Going to the question about prolonged overnight fasting and intermittent fasting, there is a lot of um, uh, information out there for different fasting protocols. There's 24-hour, 48-hour, 36-hour, 72-hour, there's 1 week fasts. And there's alternate day, there's 12-12, there's 16-8, there's like a million types of fasting. Generally, our research, we have over 20 trials within the lab, all focus on either Mediterranean eating pattern on its own, or Mediterranean eating pattern with fasting, or the combination of those two with exercise added to it. So we look at exercise and diet, essentially. What the literature at this time suggests is that a Mediterranean eating pattern plus overnight fasting is the most beneficial for people within across the cancer continuum. What we're finding is that what people are finding is there could be some benefit in these extended fasts, but the problem is that when you fast for 2, 3, 4 days at a time, what you eat after the fast is not always of the best quality, right? Or people don't hydrate enough during these extreme fasts. You can still drink water during a fast, but if you're not hydrating well, and then when you're done the fast, you're not eating good quality stuff, then it's not as advantageous as it could be. And so what we're finding with the prolonged overnight fast, which is about 14 to 16 hours overnight. So if you stop eating at 6 p.m., you can eat at about 8 a.m. the next day or 10 a.m. the next day. This seems to be the sort of quote unquote healthiest, where people can easily manage it. It doesn't put the body into an extreme stress state. And if there is a stressor that you are faced with, your body can react appropriately. In those extended, severe fasts, given that you're putting your body in this starvation state, you're losing certain instincts. So, for example, like if you're driving and somebody cuts you off, are you going to be able to react in time and stop the vehicle after fasting for 48 hours and having no external carbohydrates, right? And then in addition, when your body does react, you're going to have an increased stress response because your body is already fasted and starved, right? And that doesn't happen in a 14 to 16-hour fast. And so the recommendations right now is consuming a Mediterranean diet that's limiting red foods, processed sugars, and processed meats, eating fatty fish, a good variety of fruits and vegetables, really emphasizing the cruciferous and the nicely pigmented vegetables during the time that you can eat. Small meals are great. Remember, it takes 20 minutes from the signal to travel from your stomach to your brain to understand that you're actually full. So eating slowly, eating undistracted, don't be on your phone, don't be on your TV, right? Watching TV, and limit the amount of time that we're eating. You don't have to eat all day, right? We can have one larger meal coming out of the fast, and then smaller meals in the evening. That's generally a good way. Um, we've sort of moved to having these very large dinners, which are not really great for us because they prevent our ability to sleep and deep sleep. We also can't digest all that large amount of calorically dense food in the hours leading up to bed, right? If you eat close to bedtime, you're going to sleep with a full stomach, which is not true sleep, it's not true rest, and it's not healthy for you.
I just wanted to add one more point regarding that extended fasting window of 24 to 48 hours. Most of those studies have been done in mice. So just thinking about that fact that, well, humans are not mice, right? So the way we live our lives are very different than how mice lives their lives. So having that window that Dr. Yavelberg mentioned, starting at that 12-hour fast is equally beneficial in humans, and then progressing to that 16-hour should really get you to a place that is healthy and safe.
Thank you. If we can get to one more question, which I think is important because of grocery prices these days. What are your thoughts on organic versus non-organic? We could talk fruits, veggies, and meat too, because grass-fed, organic, stuff like that. Whoever
Yeah,
wants to go.
this is a great question. There is evidence to suggest that organic foods are generally better. Like there is quality of food here. Um, Same goes for the meats, right? Grass-fed and finished, right? Or pasture raised. But there is a concept of the dirty dozen. So not everything you buy has to be organic. There are some fruits and vegetables that, for example, avocados that don't have to be organic. And then there are other vegetables that are part of the dirty dozen list, like fruits that have a soft flesh on the outside or are grown in the ground that are recommended to be purchased organic if possible. And if you search up dirty dozen, and I think it's clean 15, you'll be able to find it easily.
Thank you. Dr. Kaur, any additional thoughts on this?
No, I would just say that, everyone has their own financial stability. So just kind of don't get too boggled down on the word organic. Just try to aim for a healthier pattern. And then if you're able to buy organic, that is something that you can consider.
Thank you both so much. We are at time. If your question has not been addressed, you could email us liferaft@liferaftgroup.org, and I will relay the questions to you too and get them back. Thank you so much. This was wonderful, and everyone have a great day.
Thank you,
Thank you
everyone.
so much,
Your
everyone.
organizations.